The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Bethany O'Connor from Health Policy Plus. We are going to get started in just a few minutes here, but we have a fun warm-up activity. We have a poll that we'd like you to respond to. So if you could navigate to the little poll drop-down box on the right-hand side of your screen and then click the answer that applies most to you, that would be great. We'll go over the poll results once we jump in. Thanks so much. Hi, everyone. If you're just joining us, please go ahead and participate in the poll that should be up in front of you. And if it's not, you can navigate to the kind of navigation pane on your right-hand side where it says polls and just click the button that applies to you. And Christine, since we're seeing your screen, why don't you go ahead and cast a vote to see if that'll get us back to the original just webinar landing slide, please.
Okay, let me try here.
And maybe it won't let you, but that's okay.
I am looking for the poll. It doesn't seem to appear to me.
Okay, no worries. Then once we close the poll, I'm sure it'll launch.
Okay.
All right. We are right at 10 o'clock Eastern, so we'll go ahead and get started. Hello, everyone, and thank you so much for joining us. This is Bethany O'Connor from Health Policy Plus. We are so excited to welcome you to today's presentation on What is Measured Matters, Monitoring Family Planning Costed Implementation Plans. We have a great broadcast for you today, and we'll begin with just a few announcements. First, if you haven't yet, please do cast your vote on the poll. You'll go to the navigation pane on the right-hand side of your screen, read the question, which is, what is your experience with costed implementation plans for family planning? And please click the answer that applies to you. Second, this broadcast is being recorded, and we'll make the recording available on the HP Plus website. And the link to see the recording is going to be in the follow-up email that you'll receive in the next couple of days. We would love to hear from you, and we welcome your questions at any time. We love making these webinars more interactive. So please submit your questions via the chat box on the right-hand side of your screen, and I will read them aloud when we pause for questions. Also, these web conferencing platforms are getting an unusual amount of traffic, so we just ask for your patience and some grace in case there are any glitches with the technology. If we encounter any bumps, we'll get it fixed and get it back moving as soon as we can. Finally, we ask that if you're not speaking, that you please mute yourself to keep the line nice and quiet while others are speaking. And now that concludes the little announcements portion, so let's meet our presenters. Next slide, please. Next slide, please. Oh, perfect. So our presenters today are Laura Hurley and Christine Lasway from Health Policy Plus. And with that, I will now turn it over to my colleague, Laura Hurley, to start our webinar today. Laura?
Next slide. Thank you for the introductions, Bethany. And thank you to everyone who answered our poll as you signed in. It's great to know our audience a little better. So our poll question was asking how many participants are familiar with work on costed implementation plans. So I think the results may still be rolling in, but we'll let Bethany let us know what we're getting.
Great, thanks Laura. So we have 4% have never heard of them before, 52% are familiar but haven't worked with them directly, and 43% have experience developing and or implementing CIPs. Back over to you, Laura.
That's great. We're really glad that so many of you are here to learn more about CIPs and that so many of you already have some experience. So we look forward to a fruitful Q&A session and discussion. Thank you. Next slide. So as Bethany mentioned, Christine and I will be presenting today. We will start with a brief reminder about CIPs and present CIP execution and our approach to performance monitoring. Then Christine will present the CIP Performance Dashboard and give you a quick walkthrough online. She will then tell you about the rollout of the dashboard in Ghana. I will then present a case study of Madagascar, which has been doing CIP execution and performance monitoring for about 2.5 years. Then we'll summarize and open it up to Q&A. Next. Next. So just a quick reminder on CIPs. CIPs are concrete plans for achieving the goal of a national family planning program. They're usually 3 to 6 year plans. CIPs translate FP 2020 commitments into action into budgets that detail the costs associated with activities for this action. CIPs also indicate performance targets that must be reached to meet the national goals. Next slide. As of December 2019, 43 countries had committed to the FP 2020 partnership, and 36 of these countries have CIPs to guide their efforts to advance planning goals. 3 other countries are in the preliminary planning process, and 2 others are in the process of building their CIPs. The 36 countries with CIPs are all in various stages of the CIP execution process. So now I'll turn it over to Christine to tell you more about how we approach CIP execution.
Thank you, Laura. As she mentioned, to date, we have 36 FP 2020 countries that have developed and launched a CIP. Launching a costed implementation plan at the end of the development phase is really a kickoff for the execution process. So what do we mean by the word execution as it refers to a costed implementation plan? Like the development phase, the execution of the CIP also requires a deliberate and systematic effort that is sustained over the period of the plan. In many cases, this means 5 years or more. To be deemed successful, the CIP execution process must be done in a manner that is not business as usual. It requires a concerted effort to change the way we approach how we work to achieve the goal, whether that change refers to how we use resources differently, as in the case when strategies shift as dictated in the CIP, or if that means increasing our joint accountability to results, the latter being the focus of this webinar. Over the years, sorry, can you hear me?
Yep, we've got you.
Okay, great, wonderful. Just want to make sure my audio is right. Over the years, CIP practitioners have come up with a framework to guide countries on how to approach CIP execution from a practical standpoint. We describe the execution process in the context where 4 key elements are in place and functioning together while requiring considerable stakeholder engagement, capacity building, and advocacy. These 4 key elements that you see on this slide today are country ownership, governance and coordination, resource mobilization and management, and the last 4th one, performance monitoring, which is the focus of our webinar today. I'd like to briefly describe each one of them. The first one, country ownership, addresses important barriers to plan execution, including lack of buy-in and ownership of the plan, and inadequate political will and leadership. Country ownership entails having a broad range of stakeholders with buy-in to the CIP and sharing responsibility and accountability for the plan's success. Notice that I use the word country and not government ownership, because all relevant stakeholders at all levels are key to the success of a CIP. The second key is governance and coordination. Here we mean having in place clear institutional arrangements for implementation. Otherwise, you would refer this to a governance model. This key calls upon countries to clearly define the ownership, oversight, and accountability roles to be performed by different institutions and individuals for CIP execution. Furthermore, this key calls for stakeholders to have mechanisms to facilitate joint planning, pooling of resources, decision-making, and sharing of information and responsibility. Resource mobilization and management is our third key. As you may know, in many cases, the level of resource requirements surpasses previous budgeted amounts for family planning. And this is so because countries aim to achieve a higher goal in a CIP. And that typically means scaling up interventions, equating to additional resource requirements. The higher level of resource requirements, coupled with competing priorities for funding, calls for countries to implement deliberate and expanded resource mobilization efforts, and also implement mechanisms to ensure efficient uses of resources. Lastly, and the focus of our webinar today, is performance monitoring. This key calls for countries to have performance monitoring mechanisms to support informed decision-making to improve implementation performance and resource mobilization efforts, as well as facilitating plan adaptation and learning. Now, in this webinar, we're focusing on key 4, and as you'll see next, it is one of the elements where countries have expressed as a gap in the CIP execution process. Now, in 2017, the K4Health Project conducted a survey among 9 Anglophone countries. This was in preparation for the FP 2020 Anglo-Africa meeting that was conducted in 2017. This same survey was repeated for Francophone Africa in 2018. What I have here is the result for Anglophone Africa. Now, through a series of 56 questions, the survey asked countries to rate where they were in regard to the 4 key elements of CIP execution. This tool is available on the FP 2020 CIP resource kit for any country to use. The 4 pie charts you see in this slide represent the distribution of countries that said they're either doing well, needed improvement, or that they didn't have the mechanism altogether. If we look at the resource mobilization pie chart, this is the one on the bottom right, only a third of countries said that they're doing well. Similarly, for performance monitoring, the pie chart on the bottom left, only 4 in 10 of the countries say to be doing well. And lastly, the 2 pie charts at the top for country ownership and governance and coordination, in both 6 in 10 countries said they're doing well. This survey and other qualitative data that we have gathered over time from different country stakeholders gave us a very strong rationale for focusing on developing tools and processes to support countries in performance monitoring as really a driver for effective CIP execution. Now I'll shift to Laura to give an overview of CIP performance monitoring, its purpose and measurement process. Laura?
Thanks, Christine. So CIP performance monitoring is a continuous process to measure progress of achieving results. It supports informed decision-making to improve governance of the implementation process and implementation performance. It includes adapting the plan or shifting and/or mobilizing additional resources as needed. Performance monitoring engages stakeholders to focus on and account for results. It also supports accountability to report on progress towards implementation and achieving goals and global commitments. Next slide. I'm not seeing slide 12. Next. Thanks. The performance monitoring process measures progress against CIP performance targets on commodity security, service delivery, demand creation, and enabling environment. Depending on the country, enabling environment can include policy, family planning, financing, coordination, and supervision, sometimes monitoring and evaluation. From the CIP goal and the strategic priorities in the plan, key results are identified. From those key results, key performance indicators and performance targets are chosen to help the country monitor their execution. Next slide. Thanks. Visual on the left of this slide shows the components of a full CIP. At the top is the CIP goal that was central to the country's Family Planning 2020 commitment. This is often framed as a target contraceptive prevalence rate, or CPR. The next level shows the 6 strategic priorities. Next, up to 80 strategic results and the 100 or more activities in the CIP. To track all of this, a country may need over 200 indicators. However, the visual on the right shows the way our performance monitoring process focuses on the biggest priorities by having the country set criteria and identify a smaller number of key results. Then priority activities are chosen that will ensure the greatest chance of achieving the key result. Key performance indicators to monitor CIP performance can then number in the 30s or 40s, not the hundreds. Next slide. This slide shows the Ghana CIP strategy map, which illustrates the different components of the plan as explained in the previous slide. The CIP map is a one-page visual of the CIP strategy with the CIP goal at the top, the strategic priorities summarized as demand generation, service delivery, commodity security, and enabling environment. There are then 12 key results numbered in the beige circles. These key results will be the basis for choosing key performance indicators and targets for the performance monitoring process. So now I'll turn it back over to Christine to talk about the performance dashboard.
Thank you, Laura. So what is entailed by a CIP performance dashboard? Well, it is a data management tool that tracks and analyzes and provides a visual display of the status of achieving select key results of the CIP over time. Over the years, we have developed both an Excel version of the dashboard and, as of recent, a web version of the dashboard. The web version of the dashboard is developed using DHIS2 technology, which is an open source software platform with growing use across many of the FP 2020 countries. When you look at the map here that I have on this slide, the countries that are shaded in blue on this map use a DHIS2 application for their routine health statistics and other uses. While the Excel version has intrinsic limitations, including limited limited data visibility and inefficiencies in data collection, which the web version addresses, countries also need to keep in mind factors related to the use of the web version, including issues of connectivity, server hosting, and initial configuration needs. For countries concerned about the connectivity issues, our rule of thumb is that if a country has access to the DHIS2 for their health statistics, then they should also be able to access and use the CIP dashboard. And as I said, there are many countries who have access to DHIS2, and this is not typically a problem. Now, let me just share a little bit about our dashboard journey in the next slide. In summary, we completed the development of the Excel version in 2017. This was actually supported by FP 2020 as well as USAID HP+. And between then and 2019, we introduced the Excel version in 6 countries. We started working on the web version last year in 2019 and rolled it out to Ghana and Madagascar earlier this year. We're currently working on setting up the dashboard in Liberia and Tanzania in the near future. Finally, we're hoping to set up the Excel version in Ghana sometime this year. So as you can see, both the Excel and the web version are being used depending on the context of the country. So we do consultations with the country to see what is fitting to use. It is important to note that when we roll out these tools in these countries, we're not just introducing a tool, but the bulk of the time is used to develop performance monitoring plans prior to tool setup. This entails defining and validating indicators and sometimes performance targets with in-country stakeholders. Earlier, Laura showed the CIP map, which had the different key results. That was for Ghana. Now I'd like to show you a sample CIP performance report looks like and what it tells us. This is what you see on your slide now. This is one of our 4 reports that you can get from the CIP dashboard, and this one is called the CIP Map Status Report. It's meant to be generated on a quarterly, semi-annual, or annual basis. And as you can see, there are rectangular bases with different colored lines on the left side of the box. Those boxes represent the key results being measured, and the colored lines represent the status of a specific result. This CIP Map Status Report is for Ghana for the period of December up to December 2018. Ghana CIP runs from 2015 to 2020, and as of end of 2018, as you can see, it's midway through, Ghana had met or exceeded their annual targets for 5 results. These are indicated in dark green. It also had 1 result that was meeting the annual target in light green in the second row, and then lastly 4 results that are gaining traction in light orange, and then 1 result in red that was delayed. This map status is meant to give stakeholders a quick snapshot of where the country is to meeting its CIP result. However, to know what is driving progress or delay, one has to go and dig further, which we'll do next. Now, before I do that, I wanted to just share that we do have 4 different types of reports that we can get from the CIP dashboard. The first one that I already shared is the CIP map status. The second down is the theme scorecard, which shows performance score trends across all key results by thematic area that Laura described earlier: service delivery, demand creation, commodity security, and enabling environment. The third down is the results scorecard, which shows performance score trends across key performance indicators by key results. And finally, the blue is the indicator trends that offer a graphical presentation of indicator performance score over time. So here I've used the word score. Let's talk about that a little bit. What do we mean by that? So first, we have 2 different types of scores: indicator performance scores and result performance scores. I should say that each result is composed of more than 1 indicator, and each indicator has an individual score. The score for the result is a weighted composite score of several individual indicator scores. I'll describe more next and how the 2 scores are calculated. So for each of the 2 types of the scores, we use color traffic signals to provide visual distinctions of what scores mean for ease of interpretation. As you see, a score that is 100% or above is referred to have met or exceeded target and is in dark green color, and scores that are below 50% are referred to not meeting targets and are in dark red. And you have a spectrum of colors, as you can see here, depending on where the scores lies in the variance of the target, which is in the second column. Now let's talk about the individual scores. The first one being the indicator performance scores. These are scores for the individual indicators that are calculated by dividing the data by the target already established in the CIP. We always try to use the indicators that are the targets that are already in the CIP, but it's not always possible, and sometimes we have to formulate performance targets. Now, depending on where the percentage score falls, as I said, in the traffic signal rubric, that indicator could have met or not met its target. This is an example from Ghana. Its first indicator is percentage of clients receiving family planning methods within 42 days postpartum. As you can see, it was green from 26 to 2018 because it met and was above 100%. And then the second indicator, annual commodities that are funded in the supply plan, that varied in performance from one year to another. It went from light yellow, and then it went down into an orange, and then it went back again to a yellow. Now let's turn to the key result performance score. This is important to understand the scores so that you can interpret the results in the performance dashboard reports. As I mentioned earlier, it's a weighted composite of several individual indicator scores. In this example, our result is enhanced leadership and management capacity at all levels. It has 4 indicators which have different weights, as you can see in the blue rectangular bars. One indicator has a weight of 10%, and the other 3 have a weight of 30%. To obtain the performance score for the key results, a weighted summation of the performance scores of each individual indicator is first calculated. For this example, and for these key results, which has 4 indicators, performance scores of indicators 1, 2, 3, and 4 are summed in accordance of their weights, 10% and 30%, as you can see on the right corner there. For the year 2016, the weighted sum of 54.6%, as you can see, which fell in dark orange, building momentum. In 27, it fell into 72.9, which was a light yellow, gaining traction, similarly for 2018. And then it went back again to a darker orange. So in this regard, countries can quickly assess how they're progressing with results and discuss why they're seeing these results and whether the underperformance can be rectified in time. Now I would like to switch screens and spend a few minutes to showcase the dashboard live for you. And I will be using the Ghana dashboard as an example. This is how we have a URL which takes you to the dashboard, and this is how it looks like. As you can see, we have flags here for Madagascar and Ghana because these are the 2 countries that we have been able to roll out. As we have more countries, more flags will enter. It's password protected, and I am a Ghana Ministry of Health administrator. And once you go in, you will be able to see different things. And this is how the DHIS2 dashboard looks like. Up here, we have been able to configure different sub-dashboards so that countries are able to just click on them to see their results and don't have to create anything new. And as you can see here, these are arranged according to the different thematic areas. So we have, for Ghana, demand generation graphs and their respective scorecard, similarly for the other theme cards. So I'm just gonna go and navigate on a few because I just wanna give you a look and feel, not really go into the details of how this all works. But here, this is the service delivery scorecard, and what you see here, this is what we call the thematic scorecard here at the top. And on this left-hand side, here are key results. There are 4 key results, and here are there are key results performance scores for different years for these 4 different results. Now, when you go down and you scroll down, you will then see each individual key results up here having its indicators that is contributing to it. Again, these down here are indicator performance scores and the traffic signal rubric. And if I can go further down, you will see If I can just go a little bit slower. This is the second results here for service delivery theme. It has several indicators that are contributing to it. Most of them are CIPs, and there's other ones as well. And you can see the variation in colors over time depending on how they performed. And the subsequent years that you see in red is basically that the data has not been filled yet. So this is how you would see your scores for results and your indicators. If you want to see the data in graphical format, you'll be able to click on this sub dashboard right here, and you'll be able to see that the graphs, and they are able to update in real time. And you're able to change different things. I'm not going to do that right here. You should be able to also see all the data right here. This first table up here shows who has actually been reporting. So if I scroll to the right, you can see this organization, Act Associate, is one of the implementing partners in Ghana, DKT International, who has reported. And some of these have started reporting directly. So the numbers that you see for 2019 are numbers that the partners have inputted it themselves. You see Marie, Stops International Ghana, and so forth. And as you scroll down again, you'll be able to see the individual data that is being collected and aggregated across the different partners over time. So this is just for you to get a look and feel of the dashboard and show how it looks like. Now I would like to shift gears and briefly describe our approach of rolling these dashboards out in the country. And I will describe Ghana very briefly, and my colleague Laura will go much deeper with Madagascar. So for Ghana, I was very excited to be part of the rollout process this early February before COVID. And as part of that country rollout, we worked with the Ghana Health Service, Family Health Division, to do three things. Well, first, we oriented data managers that are using and administering the dashboard. They already had a lot of experience on DHIS2, so it was very much a breeze. In fact, they were teaching us certain things. And then second, we oriented the different reporting partners and implementing partners to enter and view their own reports and the aggregated report. And then finally, we worked with the Family Health Division to convene the first performance review meeting for the plan. And really the purpose of the meeting was to assess progress of the CIP against the performance monitoring plan. According to the data that we were able to collect and share for the period of 2016 up to the first quarter of 2019, Ghana had met or was close to meeting targets for 9 of their 12 key results. And now I'll shift to Laura to share the Madagascar experience. Laura?
Thanks, Christine. Next. So I'd like to start with a little background on Madagascar CIP. The CIP development process took place between July 2016 and April 2017. CIP approval by the Ministry of Public Health, however, was in August 2017. It was finally launched in September 2017. The CIP execution process was launched in February 2018 with the CIP committee. Next. As I explained earlier, the CIP map is the starting point for CIP execution. The Madagascar map shows the CIP goal of increasing CPR to 50% by the end of 2020. The strategic priorities are laid out as demand creation, service delivery, commodity security, policy and enabling environment, and at the bottom 2 rows are financing and supervision, coordination, and monitoring and evaluation. Within the strategic priorities, Madagascar defined 18 key results, which have been the focus of our performance monitoring. In addition, we also monitor the 5 key beneficiary values for women, youth, and men, which are at the top in purple. Next slide. As I mentioned, the process was launched in February 2018. During this first workshop, the CIP committee developed the Priority Results Achievement Chart, identified key performance indicators, or KPIs, for each of the 18 key results and the 5 beneficiary values. Madagascar's Performance Monitoring Plan has a total of 46 KPIs. Once these KPIs were chosen, annual targets for the 5 years of the plan and priority activities were identified. During this workshop, the CIP committee also set the review schedule, which was to be held CIP semi-annual review meetings, so every 6 months. July 2018 was the first official review of the CIP. HP Plus created a data collection tool to compile KPI data from multiple partners. During this workshop, we were able to collect data for 2016, 2017, and the first half of 2018, validate the data, and develop and populate the Excel version of the CIP dashboard. We also began the process of reviewing the MAP status report that Christine showed and discussing problem indicators that were behind target. The next 2 review meetings were conducted similarly, with a focus on analyzing data, reviewing problems and challenges, and proposing solutions. This past February, the bottom line, the Madagascar CIP team transitioned from the Excel dashboard to the online web-based dashboard. The semi-annual review was combined with a training on the new tool, and the committee entered their own data into the dashboard and analyzed it during small group work. They made plans to enter January to March data before the end of May. Next. This is the MAP status report that came out of the February meeting. So as of December 2019, the CIP in Madagascar is mostly on track. Madagascar is unlikely to meet its goal of 50% contraceptive prevalence rate by 2020. The CPR was 42% in 2018, so they won't be too far behind. Indicators on youth, the 2 yellow ones at the top right, are not as high as the targets we set, but there has been significant progress. Key results that are severely delayed are in red, as Christine explained, and they are the key results under demand creation and the result that requires centralized financing for family planning.
Laura, I have lost you. I'm not sure if it's the connection.
Just that next slide.
Okay.
Slide.
Yeah, it's sorry, the connection is a little bit not clear. Sorry.
Okay, I hope everyone can hear me.
Yep, just keep going.
Okay, so before I get into challenges, I did want to share that this is a photo of the Family Planning Committee this past February. With any performance monitoring system, data is always a challenge. Choosing indicators that tell you what you want to know is the primary goal. But perfect indicators are useless if there's no data source or no data availability. Constantly changing indicators, changing availability is also not useful. Second, target setting can be a challenge if there's no baseline data. In Madagascar, community-based data from CHWs is a challenge, so we rely on USAID community health projects for their data from CHWs. Next, while we want to promote data for decision-making, the power for the decisions the Family Planning Committee want to make is often above the level of the Family Health Directorate. Thus, next steps for the committee often involve advocacy to higher levels. Finally, The public sector and private sector operate quite separately in Madagascar. While their priorities are often aligned, communication and coordination can be limited. Next slide. Despite the challenges, there have been many successes in Madagascar. Some of them have come from overcoming the challenges I just mentioned. During the last 3 years, we've definitely seen increased governance, leadership, and capacity of the government staff in strategy implementation, aligning stakeholders, and in their ability to advocate to senior government staff. Next, aligning stakeholders has been an important success. The Madagascar CIP Committee has consistent participation of 3 line ministries: the Ministry of Public Health, which leads the committee, the Ministry of Population, and the Ministry of Youth and Sport. And as I mentioned in the previous slide, while public and private sectors operate quite separately, the CIP execution process has helped to bring them together, communicate, coordinate, and share information. In addition to performance monitoring, HP Plus has helped the CIP Committee conduct annual CIP financial gap analyses. Data is conducted at the end of each calendar year, and we present the preliminary results at the February semi-annual review meetings. With the data presented in February 2019, the CIP Committee decided to advocate for contraceptive tax exemption. Through various levels of the Ministry of Public Health, the committee advocated up to the minister and supported him in writing a letter to the Minister of Economy and Finance. Tax exemption for contraceptives was integrated into the 2020 finance law, which is a huge success for the FP committee. Finally, the online dashboard allows different people to enter data, and the CIP committee was engaged and excited to enter their own data and analyze it together. They know what indicators they're responsible for, so there's increased accountability for data collection. I also think that in some cases, it could increase accountability for implementation, as they have to report on certain activities. So they don't want to report that they haven't been able to complete them as planned. Next. So my lessons learned are, first, start early. Choosing indicators, verifying baselines, ensuring data availability, and revising the indicators and setting targets takes a lot of time. Start as soon as possible. Next, involve data people, including the HMIS team at the Ministry of Health and M&E staff from different departments of the Ministry of Health and other ministries, as well as from projects who know the indicators and the issues around data availability and quality. I recommend collecting data before setting up the dashboard, finalizing the system. Setting up either dashboard, either the Excel or the web-based dashboard, is time-consuming. So make sure the indicators are preset before spending too much time. Collecting data is an important first step in ensuring that the data is and will continue to be available and reliable. I suggest you include process output indicators and outcome indicators, ideally for each strategic priority. We need to track both the implementation of the CIP and whether or not the implementation is having the effects we hope it would have. Next, we found it useful to link performance monitoring to the financial gap analysis. As the CIP Map Status Report showed, the demand creation results are lagging behind the targets. When we conducted the 2019 gap analysis, demand creation activities were only funded at 40%. So it made sense that the results would also be behind. And additional funding was found for 2020, so that's another positive for linking the two. Finally, I suggest doing some analysis of all indicators and composite indicators, not just the performers. The biggest improvement of the online dashboard is the expanded ability to visualize the data. Graphs can be generated in the Excel version, but only 6 can be saved to the dashboard page at any given time. The Madagascar CIP team tended to focus on higher level indicators and then key results and KPIs with low performance scores so we could understand and address the problems. This means we often ignored indicators that were doing well, and moving to the online dashboard showed us that some targets were set too low, and we updated a few of these in February. Next slide. So to summarize our webinar today, here are what we think are some key takeaways. The CIP dashboard is a useful tool that facilitates data visibility for a family planning program and progress achieving goals. Use of the DHIS2 platform reduces the learning curve in most countries since managers know the platform. This facilitates rapid adoption. The dashboard is most useful if used early and consistently, and if the team stewards its use. Results from the dashboard can help raise other issues, such as resource availability, stewardship, and stakeholder engagement, buy-in at different levels for the CIP process. Next. So before we wrap up, I'd like to acknowledge USAID and FP2020 as key partners in this work. I'd also like to acknowledge the work of our key counterparts in Ghana and Madagascar for their leadership, engagement, and dedication. Thank you, everyone.
Great. Thank you so much, Laura. And thanks, everybody, for your patience with the little bit of audio glitches we had. We are so excited. We've gotten lots of great questions rolling in. So let's get started. I am going to read off a few at a time, kind of in a batch. And then my wonderful panelists, please just start wherever you want to. So I'll read the first couple here. This is from Lubov. Can you please explain how you gather evidence or data to measure positive shifts in social norms and attitudes, and even greater access to services, perhaps for specific vulnerable populations such as youth? That's the first one. And then the next one is from Mustafa, interested to know how data collection is done and what are some of its challenges. And the third and final one I'll read in this round is from Samantha. Are CIP maps and map reports available somewhere online? So, Christine, I'm going to throw it to you first because your audio is much higher quality right now. Can you just jump in wherever you'd like to start?
Sure. Thank you so much for listening to us and also sharing the questions you have. The first one was how we gather data on social norms and attitudes, and I think other data on vulnerability for youth. So, my take on this question is what indicators we use, and what indicators we use really depend on the country's key results that they're measuring. You know, the selection process of which results we should monitor is one that involves the stakeholders on the ground. We have an inventory of indicators that have been validated globally from different sources. If it's measure evaluation, or if it's a JHU or BCC indicators, as in this case, etc. We try all the time to collect and populate our inventory of indicators. But those indicators may not work in a country setting. One, because besides what I already said, it may not match the results that we're measuring, selected by the stakeholders in the country. But second, it may be that the data is not available to measure it. So it really depends. I'll be happy to be able to share some of the indicators that we are using or is part of our inventory for social behavioral change and communication, which then the social norms aspect come in, similarly for youth. Second question is on, you know, the data collection, how it's done and its challenges. Yeah, and thank you so much for that question, Mustafa. It is obviously a challenge, and so I think I had mentioned before that when we sell data availability and ease of collection is one of the criteria for whether we use an indicator or not. We have a process in the development of the performance monitoring plan and also as part of the setting up of the dashboard, which is what we call a litmus test, to make sure that, to verify, can we actually capture that indicator and is it going to be of good quality data? So we go through that process before we set up the dashboard. There are challenges through that process. We usually drop a lot of indicators because we cannot collect that data, or the data cannot be deemed to be of good quality. And so those are the challenges. But when we actually set up the system, now after the validation process has been completed, we still get challenges because, as you know, this data is not only coming from routine health systems. Routine health information system is only one source, but other sources are partner reports. There's a lot of data that is hiding in partner reports. These are processed data that we need for the CIP. Things like how many providers have been trained, how many outreach activities have been conducted. Now there we have challenges as far as what is it called, cooperation from implementing partners, as far as wanting to share that result. In that case, country ownership becomes very key. Government stewardship towards the CIP execution process becomes key in getting that partner to report. Similarly, quality challenges as well. We face that, but we're able to address that as part of our trial runs that we do with partners. Lastly, the question on CIP map status and availability online. So we do have the CIP map as templates in the FP 2020 CIP resource kit, where all other CIP resources are. But the CIP map status for a particular country, we don't have that online. All that is harbored in the CIP dashboard or in the Excel dashboard that are being used in the country. So all that is password protected right now. It's not available for public use. Perhaps in the near future, it will be. Bethany?
Excellent. Thank you so much, Christine. We've got even more questions rolling through, so we'll try to get through as many as we can. Laura, this next one is for you. It's from Sarah. Are implementing projects in Madagascar reporting on time? And if so, how did the government convince them to do so?
Yes. So for the most part, we hold a workshop and invite them to the workshop, and that is the fastest way to get the data. We do expect that there'll be some delay. So for implementing partners, most of them have to write quarterly reports. So that's why we have the February, end of July, or early August schedule. So then they've finished reports from the previous time. For the new online dashboard, where they're just entering it themselves, this is a new transition. So we just training in February, so we've now sent out the request for the January to March data, and we'd like them to enter it now before the end of May. So it's rolling in, but we'll see if everyone submits on time. But the workshop has always helped motivate to enter the data. And I actually felt like they were excited to enter some of the data in the new dashboard. It gave them a little more power over the data. I also, Bethany, if I could add in response to Luba's question on positive social norms, I mean, we do have to rely on the data that's already collected in country. So a couple of our indicators come from PSI's annual survey. So it's survey data collected at the community level. And so it's annually, not quarterly data.
Thank you so much, Laura. I am going to roll over to our next question here from Lamine. Some countries are engaged in the final review of their CIPs, which end in 2020. Have you already developed a methodology guideline to assist countries to conduct these final reviews? And if yes, could you please share the guidelines? Thanks.
Great question. We actually have not developed any standard guidelines for final review. We have conducted several midterm and final reviews, but we don't actually have a guide so far. But we have, whenever a country is interested to do something like that, we're able to provide that guidance as necessary, and we'll be happy to do so as well in this case.
Wonderful. Thanks, Christine. Our next question is from Jay. I'd like your suggestion to include both output and outcome indicators. Data for output is available on a regular basis, but outcome data is available less often. For review meetings, how do stakeholders deal with the lack of data on outcomes? And how do they make decisions related to high-level adjustments to CIP priorities and strategies?
Laura, do you want to take that, or should I take that, Bethany?
Why don't you kick us off, Christine, and Laura can add if she wants.
Okay, so I'll start by saying that with the CIP dashboard, what we really are aiming for is for countries to be able to, if they want to, be able to regularly view the data on a quarterly basis. So as you said, yes, with the outcome data, we can get that. But what we use is proxy indicators that can tell us a little bit of what's happening at the outcome level. So one of the proxy indicators that we use is CIPs that are coming in, and some other data that we can get from service statistics. However, for some of the outcome data, we also advise for countries to still be monitoring that on an annual basis to sort of complement and validate whatever we're getting from the dashboard. So that's kind of how we've used it. I know Madagascar has taken a different approach in incorporating the actual outcome indicators in the dashboard itself, and maybe Laura may have can add to that.
Yeah, so I think we've chosen indicators that we can get annually. So no DHIS indicators, so we're anxiously awaiting those results for 2020. But we've taken annual indicators. So I would say that our February meeting is a little more fruitful because we have all of that data. But otherwise, we go with assuming that the previous data is still relevant. But we have a few UNFPA surveys and the PSA survey that we use for annual.
Great. Thanks, Laura and Christine. Our next question is from Jordan. Has the dashboard filtered into the annual data consensus meetings? How might results filter into future recommitments for countries?
Can you repeat that? I heard the first part on the has it filtered in the annual data consensus meetings, and then the second one is, can you repeat that part?
Of course. So the second part is, how might results filter into future recommitments for countries?
Okay. All right. Great. So for the first question, yes, it has filtered in the annual data consensus meetings. In fact, that's what we advise for countries to do. The sort of feasible way of doing progress reviews for countries has been on a semi-annual basis. So we say the first one of those two meetings could be one that is combined with the data consensus meetings that Track 20 manages. And I should say that in the different countries that we've been involved in, so for example, Ghana, Tanzania, and Liberia, Track 20 point person, M&E point persons are the ones that are also working on these dashboards as well. So we're able to see those complementarities and synergies. How results will feed into the next recommitment process. I believe the recommitment process, I don't know the details of that, if 2020 maybe can share, but I think now countries are in better position thanks to the CIP and as a mechanism to be able to have a better understanding of their country's status and goal setting process and how they've performed over the past. And so the CIP dashboard really, for example, Ghana in particular now, or Madagascar, etc., have the means to be able to say what worked and what didn't work and where are we as far as baseline is concerned. So they're able to really shape and inform their commitments now in a more data-driven manner than perhaps when we did it earlier in the FP 2020 process. Destiny?
Great. Thank you so much, Christine. We're nearing the end of our time here, so I'll just ask the last one. I'm just scrolling all the way down here. So here we go. This is from Eva from FP 2020. No question for you at all, but in case it's helpful for this audience, please do share that FP 2020 will convene technical partners engaged in supporting countries with CIPs to assess the current resource kit so that it can be updated and also aligned with the commitment process with the new FP partnership to 2030. So thanks so much for that, Eva. And that gives us time for another question. So let's see. So the next one here is from Sammy. This is the technological question. CIP strategies do change after about 4 to 5 years, and so the dashboard may need to change to capture new priorities for FP as agreed to during the crafting of the new CIP. How flexible is the dashboard to accommodate new KPIs for new CIPs without relying much on technological partners to revise the dashboard to reflect the new KPIs?
I think this is my colleague Sami in Tanzania, and he knows very well how this works. But yes, the DHIS2 dashboard is flexible for that. We are able to change the targets and the key results as we need to, but it requires some level of administrator credentials, which we have and are able to do so.
Great. Laura, anything to add?
No, I think either the Excel dashboard or the web-based dashboard, everything is changeable and revisable, but it does take some support, and the online dashboard will take technological support from the back end.
All right, thank you both so much. So that brings us to the end of our allotted time. Thank you all so much for taking time out of your day to attend our webinar. As a reminder, you will receive a follow-up email from us in the next few days that contains the link to the recording. And we just want to thank our speakers so very much for preparing this fabulous presentation for us. Thank you all to the audience for your great questions. I hope everybody has a wonderful rest of your day. Take care, and we hope to see you back here for our future webinars. Stay tuned. Thanks so much.
Thank you.
Bye.
Thank you. Bye.
Thanks.